Hello everyone. Welcome to this side session of the GNC event. We're very pleased to have you all today on this session dedicated to NiE Capacity Strengthening. My name is Cécile. I'm the GNC NiE Help Desk, and I will be co-facilitating this session together with my colleague Denka Penchova. Denka is here. Hello, Denka. She's the capacity strengthening consultant of the GNC. And we also have Mary, our communication consultant, working with us in the background. Thank you, Mary, for being with us. Again, a warm welcome to all of you who are joining us for this session. We are many today, so please use the chat box to introduce yourself, tell us where you're joining us from, where you work. And today we will have what we hope will be a very interactive, very participatory session with hearing from all of you. We will use Mentimeter. You can already join the menti.com space using the code that is displayed on my screen. The code is, you go on menti.com and then you use this code that is 97890949. And so what we will do today, I will briefly introduce our main objective for this session. And as I said, the bulk of the call today is really to have a conversation. We want to hear your perspectives, your opinion, your experiences, your suggestions on capacity strengthening. So again, here are the instructions on how to join the menti.com space. And what we wanted to do today is to collectively reflect on the importance of NiE capacity strengthening and stimulate the thinking and together with you identify success factors that can offer more tailored NiE learning that can be accessible, including among the local NiE workforce. We will also hope that by the end of the session, we will all be together on the same page with regards to the tools and the resource already available and what can we have to enable more longer-term national NiE capacity strengthening efforts. Denka, I see you're trying to say something.
Yeah, there's a lot of people in the chat saying that they cannot hear you. I can, but maybe you can cross-check again. Alexa, can you hear Cécile or me? Okay, great.
Yeah, I can hear you well, and I know most people. So let me just if it's only a select few, go ahead and check the audio settings on your computer and make sure that it's set to either your headphones or your computer itself.
All right,
great,
thank you.
Yeah.
Thank you so much. So we'll, as I said, we'll start right away diving into some questions guiding questions we've designed to do to facilitate this discussion. If you don't feel like using menti.com, do not hesitate to type in the chat box, or you can also raise your hand and open your mic. We really hope to have a lively discussion and hear from all of you. Is that all right with everyone? And I'm gonna then hand over to you, Denka, to get us started with this interactive Q&A session. Over to you.
Great. Well, thanks. Thank you very much, and welcome to everyone. I see we have quite a nice participation, so we are extremely happy. Now, I hope everyone managed to join the Menti Matter. Once again, you can see it here in the screen. You have to type menti.com and then type the code, which is 97 89 09 49. Always, as we just said, and I repeat again, let's if you cannot connect, it's not a big deal. You just write in the chat box. And our first question is, if you have only one word that comes in your mind when you think about NiE capacity strengthening. We see something coming in program quality, expertise. We have 09. I don't know what does it mean.
Maybe a typo.
Responsiveness, expertise, program quality, ongoing. That's a great word, ongoing, because we all know that we cannot learn everything on just one training. Coverage, experience sharing, great. Well, thank you very much. Good planification, perfect. I see quality is collecting quite much of the votes. Technical knowledge, targeted, very important, targeting the knowledge gaps, effective or effectiveness, prioritization. Yeah, we have this nice reflection. And I am extremely happy to not see here training, which is
just one word,
great.
one
It means
word.
yeah, once said, but maybe it's not to deny the importance of training, but just to say that training is just one modality to strengthen capacity amongst many others. But yeah, I see things are moving, so we continue with skills, with mentorship, interventions. What haven't I say? Yes, Cecile, go ahead.
Just to say, I see we have only 18 to 20 people on the menti.com space. So to everyone else, if you feel like typing your word in the chat box, you can do that as well.
Perfect. So we see all these words, and I think this is a reflection of what actually capacity strengthening can be, because it's not only acquiring knowledge, but it's also acquiring skills that are tailored or targeted to specific needs. And yeah, we have also the word tailored. We also have all this dimension of good planification of capacity strengthening, and the fact that capacity strengthening is an ongoing activity that, and it's not even activity, but it has to be planned in a sustainable way. So giving a chance to all that needs to achieve their knowledge, skills, ability, and attitudes. And all this because we want to have effective response. We have to have program quality. We have to have quality intervention. We also, what do we have here? And we have to achieve, of course, a good coverage of whatever we do, but also the coverage of the capacity strengthening activities has to enlarge as well. And yeah, and then we have to have a good mentality. So we have to have a great mindset to actually think about this ongoing and long life learning.
I like that one.
Yeah. So, well, that's great. I think we had these great words here. And individual counseling, I will say also mentoring, coaching, and all these words that I probably didn't mention. Yeah, great. Well, thank you very much for your participation. And I see the qualities at the center. Yeah, quality, what we aim with capacity strengthening to have quality services delivered where they have to be.
We'll keep all this in mind as we continue discussing.
Yeah, great.
Great. Shall I move to the first question of?
Yeah, let's go, because I don't see new words coming up.
All right.
Okay, sorry.
Go ahead.
Our next question is, from your experience, only your experience, what are the factors that have made it challenging to prioritize capacity strengthening at the subnational and national level? So please think about that. You can also think about the various, for example, the environment in which we work, like the humanitarian program cycle. And we said we have already lack of funds and exactly competing priorities, lack of funding, technical capacity. Yeah, time limitation, very important. Very often we just don't have time for capacity strengthening because we have other priorities. Yeah, limited funding for formal sessions, other priority, time limitation, staff turnover, very important. Yeah, we are in this very dynamic environment in which we have to always, with all this mobility of people, we have international actors that are prioritized. Yeah, very true. Sometimes security situation. Maybe Cecile, you can move down, or I can look at my own.
Yeah, I'm moving down. Yeah, please, colleagues, keep sharing your specific examples in your experience. Why capacity strengthening is always deprioritized.
Yeah, I will continue probably, because if you move, you might, yeah, we might be able to move. Okay,
yes,
what had tailored capacity content is challenging to be achieved, poor well-being, lack of context-specific training, resource materials that are not specific, funding gaps. Funding has been mentioned several times, which is, I think, very important. Yes. National level has been reinforced with the capacity to execute, but not to make decisions, which is also quite demotivating. Lack of context-specific training, piecemeal, yeah, and longer-term vision for what is needed in the capacity strengthening. There is always this urgency to respond and no time for anything else. Limited transportation, communication, funding, security issue, internet connection, unable to get appropriate training tools due to political crisis. Maybe we need to clarify this one. And of course, if some of the colleagues want to take participation or speak out, please go ahead. Do not hesitate. If you want to bring your examples, just raise hand.
Resource mobility. In the chat, we also have lack of clear ownership and coordination, which is indeed, that can indeed prevent us to prioritize capacity strengthening.
Yeah. Box ticking exercises. I think we also mentioned that during the session in the main event, saying like, that the capacity strengthening is always seen as a checkbox exercise. Localization, the crisis, again, limitation of the resources, lack of expertise in country, or maybe I can argue, maybe there is an expertise in country, but we don't use it enough. Is there something else coming in here? Lack of national curriculum and protocols, very important. Expanding conflict areas around the country. Yeah, the crises are getting bigger and taking bigger territory. Not among the key indicators. Yeah, it is not among the key indicators to be reported in the humanitarian responses. National policies, I assume this refer to policies of the national governments when we talk about nutrition in emergency, capacity strengthening. You see anything else in the chat, Cecile?
Let me look at the chat. There is a comment from Alexa who wanted to hear more from those who listed localization as a challenge or a barrier to prioritizing capacity strengthening. What is meant by this?
Yeah, maybe if someone can come up and say, the person who said that, probably you have a very interesting perspective to let us know. Or if you're too shy, you might just write on in the chat box. But here, some of those other factors are coming in, you know, the recurrency of the conflict, strict rules and regulations among citizens. Maybe this need to be clarified. Language, which is a challenge and also a big barrier because everything is in English always. So security and access constraints, lack of funds.
So Denka, do you want me to try to recap a little bit the main?
Please, yeah, let's recap because I don't see anything else coming in the Menti. So and if I saw someone in the chat, maybe you can recap them as well.
I'm not sure I'll be comprehensive or exhaustive in my recap, but so we noted a lot of the barriers to prioritizing capacity strengthening were linked to the lack of funds. So it's true that we are often driven by short-term humanitarian funding cycles that may prevent us to secure the financial resources for capacity strengthening. We are also having some inputs looking at the fragmented, how can I say, no coordination of capacity strengthening efforts across all the actors. That's also a bit of a challenge. We're also a lot in an emergency mindset, preventing us to have the space to reflect and do longer term planning and system building. Sorry for that. So yeah, we have also the lack of maybe national framework for NiE learning, or maybe NiE not embedded, NiE learning not embedded, institutionalized. Might be the localization aspect to someone who shared on that earlier. The lack of dedicated staff as well to lead or manage capacity strengthening. So that's something also that we can keep from that. So we might want to think of possible solutions to all this. Something that Denka and I will always promote a lot is to make sure that capacity strengthening is embedded in preparedness plans and response plans. Maybe we need to do a lot of advocacy vis-a-vis donors, not to, to fund long-term national plans for capacity strengthening instead of just one activity, and really engage with the national actors and co-lead capacity strengthening planning and implementation with those government counterparts, not seeing them as beneficiaries of capacity strengthening, but really co-creating, co-designing, co-implementing capacity strengthening with the broader actors of the sector. All right.
Maybe just to add something about the monitoring, because from my perspective, I see how hard it is to monitor the outcomes and the impact of capacity strengthening. Yeah, because of the turnover, because of lack of longer term strategies and this capacity strengthening plans and so on. And I think this is a big challenge because we all evolve in different countries, in different organizations and so on. So I think that is also what prevent us to actually collect enough proofs or enough evidences for the advocacy for funding to bring all these good examples so we can have a little bit more strength when we advocate to donors. So I think monitoring is quite important if we can find a way to do it.
Indeed.
Well, thanks. Thank you very much. So a lot of challenges. So maybe we go for the next question, Cecile.
All right, next question. Here we go.
Yeah, now, what barriers have you faced or observed when trying to access nutrition in emergency learning, but locally? So we speak now locally in your countries. What are the barriers you're facing? And again, please share your experiences. Yes, Cecile.
Yes, we wanted to hear from any one of you maybe working at the subnational level, or if you've witnessed, for instance, a nutrition focal point from a district. What are the challenges for this district nutrition focal point to access to NiE learning? What have you witnessed? All right, start to have contributions.
And by the way, if there is a French-speaking people, please write in French. There's no problem. The question is, quelles sont les barrières que vous avez rencontrées ou observées quand vous essayez d'avoir un accès à l'apprentissage en nutrition localement dans vos pays ou dans vos districts? Bon, okay, so I see language, which is indeed a big barrier. Even now we speak in English. Yeah. So we try to translate a little bit in French. And our ambition is, in fact, to whatever resources we produce at GNC level, at least all those global and generic resources, to put them out in different languages. But it's quite difficult because, again, lack of funding. But we're working on that. We have people saying that qualified staff is a barrier to learning, maybe qualified staff in terms of qualified trainers, transportation block or transports maybe, limited learning resources and opportunity, language connectivity, yes, indeed, that comes up very often, the internet connection, behavior related to nutrition. I assume it has something to do with barriers or the fact that nutrition is often misunderstood and seen as food, probably, because I have met this very often in my life. Resource persons, indeed, training tools and qualified trainers who can teach local language. What else? An existence of locally produced material. Maybe we can see here something like weak monitoring is saying Miriam in the chat box, which is seen as barrier. Overwhelmed with workload, of course. Yeah, maybe I can. I don't know if you see, do you see, Cecile, something else coming in the chat?
Nope.
Please also do not hesitate to raise hands. I mean, like, we are here and you all have the opportunity also to speak out, to bring some examples, or to say what's in your mind around this. The limited engagement probably from individuals.
I
Okay,
think,
maybe, yeah.
yeah. So just to share that, so yeah, we've seen the language, the accessibility are really like big barriers. Most of our resources developed at the global level are in English. There is also something that to me is really a big, I mean, can be a big barrier, and I think we touched upon is the dependence on external training opportunities or external trainers. They have to come in. So someone based at the district level might not be aware of even the training opportunities, might not be in the right network. And then there is the lack of time, the heavy workload that a district's nutrition focal point might face. And often we hear that it can be a luxury to have multiple days for a workshop, or even time for self-paced self-paced courses. Yeah.
There's two, I think, important thing that came up in the chat. First was, in the Menti-Mentor. First is around the recurrent crisis, recurrent conflicts that never ends, and that national policy doesn't take into account. And then you have the integration of nutrition in national priorities, including emergency preparedness and response plan. And yeah, so in the courses that are generally in French and English. And limited focus to national level. These are all barriers that has been also additionally mentioned in the Mentimeter.
So I think, Denka, if we wanted to think about possible solutions, I hope that, so the working group, the dedicated working group for capacity strengthening is currently working on designing NiE learning pathways. We hope that those NiE learning pathways will then be adapted in your own context. And we hope that also we can think of more modalities of learning with flexible formats, and think of these very important modalities, that is the peer-to-peer exchange, the on-the-job training, the learning by doing. Like, these are really important modalities that hopefully can really enable more access to learning locally in more flexible manner. But yeah.
There was Koki raising hand. I think she has something to share with us. Koki, please go ahead.
Yes, thank you very much. I was wondering to what extent should I be able to comment, but let me see, because we did prioritize in Afghanistan the NiE training in 2023. And 2024, finally, we got the funds. So the whole delay was basically because of funds. The funds came through and we had a robust plan, of course, supported by GNC. We got someone on board. Very detailed updating of the slides was done, contextualizing the slides, doing a whole week training and a TOT training. And from there, then there was also, we developed subnational slides that were also contextualized and also to the staff that were going to be trained. At the time of the rollout, then we again fell into funding constraints because of the BHA funding cuts at the time. Then some months later, again, we got money. And then even when we got money, there's some, I didn't know how to call it. Is it bureaucratic impediment? Is it donor red lines? That given that we are also working in a context that, has a de facto authority, so it's not been possible because the P&D are asking, or rather the Nutrition Directorate is asking that, our colleagues in the field need to be trained, and who are manning the whole subnational monitoring from the ministry side. They can't get involved because of the donor red lines. And then again, also, we had very big plans in terms of developing a mentorship guide so that the TOT pool that we had at the national level, because our training had been done like twice before then, and we had lost people. And so we needed to have these TOTs move on now with a mentorship guide, mentor them so that we maintain a national capacity. So I think there are two things. So firstly, that when we are getting funding, that at the initial stage, that this funding for training, includes the whole array of things, including the mentorship, which would have been very useful. So this sustained NiE capacity building approach is very important, because then we feel frustrated that probably we are losing, we lost it. We should have maybe put everything together. But of course, we are also working in the humanitarian sector, or in some of these countries, we are working in a context that is not very straightforward at the same time. Thank you.
Thank you so much, Koki, for sharing.
Yeah, the experience but I think also it's important. I will retain your words of trying to fund the whole of the exercise, including mentoring or some other modalities, to continue and to sustain the learning in altogether. And of course, like in Afghanistan, it's like so particular situation, and there's so many challenges. But I think this is something that I will retain.
Yeah, as well as maintaining a pool of trainers in country. That's also a big achievement. It's something that would really, we hope, could happen on a more systematic basis. All right, let's move to the next question.
Okay, let's say now, okay, so we would like to learn from you about good practices or good examples. We had some elements from Koki's intervention, but what are the good practices or initiatives that you have seen supporting the needs of the local, again, nutrition in emergency workforce, especially for those that are, we call now the local and national actors?
And feel free to raise your hand and come in to speak. It might be easier to speak than to type.
Okay, so some feedbacks are coming. We have multi-sectoral training. I think it's very important knowing how many facets the nutrition in emergency field has. Trust is a good practice. Trust in maybe in our own capacity, maybe, or trust with the local and national actors, and having confidence in what they are going to learn and implement later on. Planning is a very good practice. Having capacity strengthening plan is something that can help overcome some of the difficulties in target learning. Working with national staff to align the training, exactly, trying to co-develop learning content, library of trainings and relevant technical resources. We might present some of those later on. At least that we have here at a GNC level. Engagement in consultation with partners and governmental counterpart. Yeah, this is extremely important. This engagement has to come since the start. So collective construction of NiE local plans, exactly.
Mm-hmm.
Securing management buy-in. before starting, very important. Development of SOPs for nutrition preparedness and response at national and subnational level. Perfect. Yeah, trust in the LNA local knowledge. Very important. There's no way to continue thinking that people from global or some imported knowledge is the most adapted for everyone. Like, people in countries have their own knowledge that has to be maximized and further utilized. Sustainable support from policymakers.
I wanted maybe to ask the audience if anyone has an example of a country where a curriculum is for nutrition in emergencies is integrated into, for instance, the national health and nutrition curriculum, or in, I don't know if a Ministry of Health has a dedicated emergency operations center. I don't know. Do they have you seen a place where NiE learning or capacity strengthening is really embedded and offered into a national system? Because if it exists, I really would like to hear and learn from it and be able to derive some good principles and apply them elsewhere. Or if you've seen like examples of places where on-the-job coaching or on-the-job training is also really part of the services, of the programming, like including for health, the frontline health workers. Any examples around this?
Yeah, please tell us. Maybe you have some great examples.
Can do the difference. But we have a good collection of good practices already.
Yeah. So maybe some of those that I can read and sum up is like collaborating with local trainers, as well as having co-building learning contents. One very important practice is to assess the learning needs in advance, including, language, internet connectivity, and so on. So that's a condition to not fail. Multi-partner collaboration, joint efforts. Yeah, so online platform to keep alive key NiE aspects as available in Agora. Yeah, that's something that we will have to work on. There's someone saying in Nepal. Yeah. There is example from Parbat saying that Nepal has incorporated the policy, but I'm not sure about the situation of implementation, which unfortunately can happen. And this is something that we have to push for further the governments and local institutions to actually continue. But monitoring.
This is important. There are some countries where we have opportunities to work closely with those who are designing those nutrition policy and strategies, and working with the government counterparts to include a capacity strengthening component in the policy is really important. I think recently in some countries I've heard also works with the Sun movement is also another opportunity to push and influence for long-term capacity strengthening efforts. All right, Denka, I think we need to move to our last question, just because I see the time going by.
Yeah, please move.
All right, this is the last question.
Okay, our last question. Our last question is about sustainability. And according to you and in your context, what can work or have worked to sustain NiE learning and capacity over time. If you have any lessons learned, or if you want to share again any approaches that you know about in your country, it will be great to share here so we can learn from each other.
And again, do not hesitate to come in and speak. I think we're going to start to point and touch upon a bit the same notions we've been feeling now. But yeah.
So what can ensure this sustainability? What can be useful for sustainability? I'm thinking about one. In nutrition in emergency, we see people are coming into this field and they learn, you know, as you said, Cecile, in a fragmented way. And of course, at the end of the day, they might have a lot of gaps, and you have to remain in this field for a longer term. But it is very unclear since the beginning. If I am an individual, what is my career perspective? How can I develop? If I am an IT or something, I know what I want to be and how to go there. But in our field, how do we do that? So that's maybe when you give a perspective to an individual, that from my side can be something that that may help of doing something in that direction and sustain the learning. But again, there's a lot of factors that comes from developing training materials in local language. So the people can learn community engagement. How do we involve the community in capacity strengthening activities? So people who will remain there. We have partnership. Oh yeah, that's a very good partnership with academia in country. Extremely interesting point. Use of local trainers. It has been said before, in coordinating, incorporating NiE activities as essential element in the project, but I would say maybe in curriculum of health workers. Government and community engagement, targeting government at local level services.
I like a lot
forum, community of practice.
Yeah, I want to come back to the point on partnering with academia in country. I think it's really an important means towards sustaining a capacity strengthening effort in the long run. We'll briefly speak about it shortly after this, but this is also something we promote a lot in our strategic approach for capacity strengthening, like trying to foster the existence of national training hubs. That would really help with universities or with national training institutions to try to maintain this pool of national trainers. That would be a really, really key piece to me. Sorry, Danka, you can continue.
Yeah, I'm just reading some of the other examples and other, practices to sustain, like developing training curriculum in local languages, advocate for them at national level, to be done at national level. There's a question, is it possible for GNC to lead on NiE strategy from best practices and to guide sustained approaches? We will answer this question later on. That's perfect. Upgrade training courses and materials and practice. It is important because the knowledge is changing and enlarging every day. So we have also the contextualization of resources, very important. So they remain relevant for the context in countries. FMA is an example of community engagement. Probably I will need a little bit more clarification on that one.
What is FMA?
Yeah, I don't know. Maybe the person can say. or type it in the chat. But yes, there's also TOT. I mean, you just mentioned about the TOT. Family MOAC approach. Okay.
Oh, yeah.
Yeah, it's an example of community engagement. Of course, it's the same mechanism. In fact, you give to the people capacity, and they are happy. Identify IYCF champions at national level, but champions in anything else as well. Why not? I mean, it's not IYCF, it's just one example. Yeah, contextualization. I think that's we have quite a number of examples or suggestions to sustain NiE learning.
I thank you. Think I just keeping track of time. Maybe I'd like to just to say that all these inputs are really, really great. All this thinking will definitely be something we will reflect on. So last year, the dedicated working group at the GNC working on NiE capacity strengthening developed a strategic approach to support you in your effort in developing national capacity strengthening plans. And we've recently, earlier this year, published it on our website. And maybe, Danka, we can think of a second iteration of this strategic approach based on all the reflection we've heard today. But let me take the floor. I will come back to the mentee, but let me take the floor to tell you a little bit about this strategic approach that the working group framed to guide us in the work we do on capacity strengthening. So we have, sorry, Danka, can I go ahead? Or
no, please go ahead while I will put the links to some resources, including to the approach in the chat box.
All right. So since you've been asking for support on this strategic approach to more tailored and local capacity strengthening efforts, yes, we have a proposal, we have an ambition. At the GNC, we have a strategic approach that includes a theory of change that now drives our work. And maybe you heard me saying this already last week, but basically we believe that if we equip a broader audience of NiE practitioners, and especially among national and local actors, with the knowledge, the skills, the tools, and the confidence they need, and if we use more innovative and flexible approaches to learning, approaches like the support peer-to-peer, that supports peer-to-peer exchange, and that truly respond to local priorities and specific learning needs, then we have this catalytic investment that will eventually lead to more locally led and more context appropriate NiE responses. So what's in the making to realize this ambition? Right now, we're working on designing NiE learning pathways closely aligned to the GNC's competency frameworks on nutrition coordination, information management, and NiE programming. We want to make sure that all the essential learning materials will be available in multiple languages, accessible at different levels, and importantly, adaptable to the needs of the country teams, right? So the goal is no longer to deliver training, one-off training from top down, but really to equip country teams so they can design and drive their own national capacity strengthening plans. We believe that all this can only be achieved through strategic partnerships. We mentioned it today, for instance, with national training institutions, universities, and very importantly, with actors that are already embedded in national systems. And finally, Denka and I are exploring the possibility of piloting the use of generative AI to improve and enhance NIE learning. We want to imagine that we can have AI-powered tools embedded directly into resources, for instance, to create personalized NIE learning pathways, or to transform large and complex guidance into bite-sized, digestible content that's easier to access, to understand, and to apply, including in times of emergencies. So yeah, we hope that we can embark all of you in this new way of doing capacity strengthening. Let's make it more local, more sustainable. And as I said last week, we are not just strengthening capacities, we are shifting power. We are not just training people, we are really empowering them. So please do know that we are here also to support you in your efforts in doing longer term, more local, more systematic capacity strengthening. We have a bunch of resources already. We have toolkits, checklists, we have the GNC Learn platform. We have this strategic approach that guide the work. Please visit our websites, our dedicated webpage, and do not hesitate to request for support. And if you want us to brainstorm with you and think, how to move that ambition forward. With that, we have one last call for action. Over to you, Denka.
Yeah, okay, great. I hope you learned something new from your colleagues today, and also from what we endeavored to do. We are just in the beginning, and we hope we're in the right direction. But we will be really happy after to know after today, or do you have some new idea or some one thing that you will do differently to strengthen the capacities and capacities in your country and in your context? Have you had a kind of new idea and said like, wow, maybe this is important to do? So please go ahead in the Menti.
Yeah, you can use Menti. I don't see a lot of people in the Menti. So if you are not on Menti anymore, you can use the chat box. But tell us, what's one thing that you're going to do differently from now on?
If what we say makes sense to you, maybe you can have an idea to do something.
Or
maybe you can
any remarks?
Consider AI tools to enhance training. That's the future, unfortunately. Even in our context, that's the future. Maybe fortunately. I think we have to cleverly use this great opportunity that is offered to us. For training, I would say, for learning, for quick and easy learning delivery to people who actually need it. What else? You can think of starting doing capacity development plans, for example, in your countries. We're here to support. And yes, explore partnership with local academia. Exactly. Yes. So that's the way to sustain, maybe one of the ways.
And advocate vis-a-vis donors to fund your national capacity strengthening plans, not just one-off training every two or 3 years.
I hope someone will say, I will no longer search for external consultants for training. but we will see how to mobilize our internal capacity to actually do it and have tailored to my context training or other modalities that may be there. Because exactly, someone say like, I'm going to enhance collaboration with local actors. Yes, because local actors can know a lot of things. We can learn a lot from people who are in countries. About the national capacity plan based on the context. Thank you very much. That's great engagement. Yes, maybe people are still thinking.
If there is any, I mean, if you want to come back to us at a later stage as you think through this, do not hesitate to contact us.
I think even the Menti will be active for sometimes, right? After the session.
Yeah, for a few days. I can double check that. But yeah, I think till the end of the month. Yeah, or for a couple of days or more, we can still look at it.
We have another answer coming. Close follow-up and monitoring of IYCF by reporting on IYCF indicators. We will be really thankful if you also share after what has happened when you actually started doing that. Enhance collaboration with local actors to contextualize the NiE capacity building plan.
Yeah.
Local actors can be governmental bodies, educational institutes, or other active partners. Yes, that's great. This is also one way to engage and to foster ownership of
and to make sure that the capacity building plan aligns to the local realities and the local needs.
Local priorities, yes.
Very important.
Great.
All right.
Please keep going. For if you have an idea, just type it here in the Menti or even in the chat box, even after the session is done, because these are things that we need to learn from you, because whatever we do comes from you and for you. People on this call and people engaged in nutrition and emergency response in country. So yeah, Cecile, you have something to conclude?
I think this is, we're reaching the end of our session. I guess this is time for us to wrap up. I just wanted to thank you, Denka, for co-facilitating this interactive Q&A session with me. I hope, colleagues, you've had a bit of time to reflect on how important it is to strengthen capacities for NiE. And again, feel free to reach out to us if you want to brainstorm more, share more, or receive some support. Denka and I will be happy to help you.
I saw Ruben raising hand and then he said like that, but well, thank you. We receive a lot of cards.
Thank you so much. We need to close this call. Thank you so much, colleagues. We'll share the recording and some meeting notes afterwards. Thank you, everyone. Have a good rest of the week.
Thanks for your help. Great. Bye-bye.